honestly, sometimes that's why people are stuck or they're not making progress is because they're in this state where they're constantly in a fight or flight. And if you think about like a dog, what does a dog do when it's scared, when it's anxious? It tucks its tail. And so we do the same thing where we're clenching and tucking our pelvis. So you can develop a lot of abnormal tension in that way. If I just sit there and I release the muscles and tell it to calm down, it's going to come right back because your body still feels threatened and it still feels like it's in that fight or flight.
Welcome to Collective Guidance. I'm your host, Charla Goodnight. Today, we're going to talk about a subject that is very personal to me, and I know a lot of women struggle with this. This is a topic that not many people want to talk about, because it's so physically personal. I was presented with this speaker and I immediately said yes, because this is information as women that we need. We need this information so we know that we are not alone in this human experience. My guest today is Dr. Bri Thornton, who is the owner of Holistic Health PT and Wellness, a holistic physical therapy and wellness practice in Bonita Springs, Florida, which she specializes in pelvic floor therapy and functional medicine. She is also the co-owner of Rooted Renewal, a holistic preconception program and community. She is a certified functional medicine practitioner, a pelvic rehab fertility specialist, a certified strength and conditioning coach, and a postpartum corrective exercise specialist. I am so grateful to have you here, Dr. Bri, talking with us about such an important topic. I know a lot of younger women that I have the pleasure of being friends with who have had babies. And myself, I have had 3 babies. I have 7 or 8 nephews and nieces. So all of my 3 sisters have had babies. And the pelvic floor is so important. And whenever you have a baby, they don't tell you that you need pelvic floor therapy after. So I'm excited to go on this journey with you. Thank you so much for being here with me.
Thank you for having me. I'm super excited.
No one tells us about this. This is not a topic that when you go to the OB-GYN and you have your baby, they're like, you need to go to physical therapy for pelvic floor. How did you even decide to go into the industry of pelvic floor rehabilitation? Take me back to the moment where this became your personal mission.
I was very against it at first because when you hear about it, it sounds kind of scary. It's like, wow, that's a really intimate area to specialize in. So I was very anti pelvic floor therapy at the beginning because I was like, there's no way this is for me. I actually always thought I was going to work with athletes as a former Division 1 athlete. Like, this is where I'm going to go. But I'm one of those rare people that actually had pelvic floor issues without having children. So when that happened to me, I realized how challenging it was to find someone to help me, and I was in the profession. So as a physical therapist, I knew it existed, I knew it was out there, and I knew what they could do, but I just couldn't find anybody around me that could help me. So when I finally did, and I saw how helpful it was, I basically was like, wow, there is such a need for this. I'm going to go take a course and see what I think about it. And I went to my first course and fell in love with it. And I loved how it really blended well with a more holistic look at a person, recognizing that even if someone comes in with leakage, you're not just hyper focusing on their pelvic floor and their bladder. You're thinking about, well, what does this person do physically? Are they an athlete? What is the rest of their body doing? How's their gut? So it just seamlessly fit into what I loved about holistic medicine. And I got super hooked after that first course. And I've now been taking probably way too many courses because I just find it so interesting.
Yeah, it is way more than leakage, isn't it?
Yeah. And for me, I had a little bit of leakage, but that wasn't my primary complaint. My primary symptom was I had pain with intercourse and pelvic pain. Like it hurt to sit for long periods of time. So that was my primary complaint. And being in the profession, I knew that you can have leakage, but it may not necessarily be from a weak pelvic floor because I already knew I had a really strong pelvic floor because I know how to test that. So that's when I felt like there wasn't a lot of information on the other side of it. Well, I have too tight of a pelvic floor. How do I fix that? So
Oh.
that's when I ended up in therapy because I felt like all of the information that was out there for leakage was all about strengthening. And I just kept saying, well, that's not my problem. So like, what do I do?
Yeah, so it can be reverse. Either you have leakage or you have too tight of a pelvic floor to where it is intense and causes pain when you sit or have sex.
Yeah, yeah. So leakage can be simple in the fact that if pressure above is greater than pressure below, you're going to leak. But what contributes to all of that is way more complicated. So that's why I tell people it may seem like a simple issue that we just need to strengthen, it'll get fixed. But most of the time, for a lot of my patients, it's not that way. So you really need someone to really sit down and do an individual evaluation to figure out what your problem is so that we don't just start doing what we think we need to do, but really we're heading the wrong direction.
Do you think that women, after they have a baby, they should get pelvic floor therapy?
I think it's always a good idea because it's individualized then. You know exactly what you're struggling with. You know if you're struggling with pure strength or is it endurance or is it like load transfer? Do you have too tight of a pelvic floor? Do you have prolapse? How's your urethra look? Like, unless you do an internal examination, you really are guessing. And I tell people all the time, I've been in this profession for a very long time. And I still don't always guess 100% right. Like sometimes
Right.
someone's symptoms and how they look and what they're telling me, I'm like, ah, this person's 100% a tight pelvic floor patient. Like I got this. And then I do their exam and I'm like, dang it, it's prolapse contributing. What the heck? I got it wrong. So unless you do an internal examination, you don't 100% know what's going on. And that's why the gold standard for pelvic floor therapy will always be an internal examination with a skilled provider. It's not going to be virtual physical therapy. It's not going to be an online program. Those things are great because once you know what's going on, you can find one of those things that is maybe more specific to what you have going on. But getting that first exam is really helpful. And I have a lot of patients who drive over an hour to see me just to get that in-person exam. And I say, okay, this is what you need to work on. And then maybe, yes, they are grabbing an online program that I think is appropriate for them. And then they communicate with me virtually or through email.
But typically, that exam is an internal exam where you are touching inside of them to feel what is happening in their body, correct?
Yeah, so the pelvic floor muscles are kind of like a trampoline of muscles that sit at the bottom of the pelvis. There are some muscles you can access on the outside, so your more superficial muscles, but to access those deeper muscles of the pelvic floor that sit inside the pelvis, you do have to do an intravaginal or an intrarectal exam.
Yeah, I had to have an intervaginal. It's painful and
It's
it's can be so vulnerable. I remember the first time I was like bawling, crying because I was like, it's so vulnerable. And
yeah.
it's kind of painful.
It depends. It's not supposed to be painful. Here
Mm,
in the office, most of us pelvic floor therapists, we don't use speculums for our
mm.
examinations. So it's a lot more comfortable when you don't have to insert a speculum. But it's not supposed to be painful. So I tell people sometimes the first sign that something's off is that pain is present.
Mm.
So when we go for our exams, like inserting a speculum should be pretty comfortable. If it's not, that can be a sign of dysfunction. But here in my practice, I do a lot of things to make that exam more comfortable. I've got a heated table. It's just a very relaxing environment. I have tons of plants. I even have a little office pet in here. So I try to make it not feel like a doctor's office because some people have previous medical trauma where as
Mm.
soon as they enter an office that looks very sterile and medical, they almost clench up and freeze. So I do try to make it a very nice, relaxing space. And it's usually the last thing of the day. I want people to get comfortable with me, and I want them to get comfortable with my hands touching their hips and their back and things like that first before we move on to something so intimate. And patients always have, the ability to choose to delay that internal examination as well.
Yeah. What are some symptoms women normalize that should actually be addressed?
Leakage is definitely the most common symptom that we normalize. You'll see jokes everywhere on the internet
Mhm.
of like, oh, I just peed myself when I coughed or sneezed, or, I'm laughing and tears are running down my leg. So that's the most common one that we normalize. It's extremely common, but it's not normal. That's often one of your first signs that something's going on. I would say some other ones are like pain with intercourse. You'd be surprised at how many people have discomfort with intercourse and they've normalized it and said, oh, well, that's what it's supposed to feel like. And I have to tell them, no, like intercourse should be enjoyable for both of you. It should feel good. So that's one that I hear people normalize all the time. And just any pelvic floor symptom at all after you've had children. People will say, "Oh, well, you have prolapse, you had children, so that's normal." And it's frustrating because it makes women believe that we just have to put up with this dysfunction and just deal with it. And it's just not a great attitude to have because women deserve to feel strong, to feel healthy, and not have to worry about all of these things.
Yeah. It is if someone has they're peeing themselves, are there solutions that are not surgical that can actually fix it?
Yeah, so the first thing I have patients do is I have them come to my office so I can do a full exam. With with leakage, sometimes it is a strength issue, sometimes it's a postural issue. Like for example, I had a patient who loved this trampoline class in town, but every time she would take this class, she would have leakage, and so she wasn't going to the class as much because of it. And she had been working with another pelvic floor therapist for a while, and that therapist was going on maternity leave, so she was stuck with me. And so I'm having her basically simulate jumping in the clinic, and I'm watching her, and I give her one cue. I just give her a cue that has to do with her spine posture and her ribs. And I say, okay, I want you to do this when you go to trampoline class, and then let me know how you do. All she did was change her posture with that class, and she had no more leakage. So sometimes it's not just the pelvic floor, it's how the pelvic floor is responding because of what the rest of the body is doing. So there are some simple solutions that we can do. Sometimes for patients, especially postpartum, if they're breastfeeding, their estrogen is really low in the pelvic region, and that can impact the urethra. So sometimes I will say, hey, I want you to do this experiment with me. I want you to put a little lube on a tampon, insert it, go for your run, and tell me if you leak. And they'll say, oh my gosh, I had 80% less leakage just from doing that. So then we can swap because I don't love tampons. They're not the healthiest things in the world. But I can say, okay, let me fit you for this pessary. It's a medical grade device that will basically hold the organs up. It will add a little pressure on the urethra, and you can put that in whenever you go for a run.
Can you just tell us what that instrument is again?
Yeah, it's called a pessary. So a pessary is a medical grade device, usually made of like medical grade silicone, something like that. Comes in tons of different shapes and sizes, and you basically insert it into the vagina and it will hold everything where it needs to be. So that way you make sure your pelvic floor is always underneath the organ so it can work appropriately. So as providers, procedures, we are looking at what type of prolapse you have. Does your urethra need support? And we can add this device that is super easy to use. So, for example, I was training for a marathon. And so I have a pessary. It's a little ring that I basically fold like a taco. I insert it, it opens up, and it keeps everything held up so that while I'm going for my run and all that impact, it makes sure that my bladder never falls too low where I'm going to have a leakage episode. And then when I'm done running, I can just pull it right out, wash it, and I'm done. So there are so many things out there that are non-surgical that we can try. Some of them are over the counter. Some of them you have to purchase from a provider. But as pelvic floor therapists, that's one of our jobs, is to be aware of what are all of these different tools and things that exist that can keep you from getting surgery if you don't really need it.
Yeah, isn't there a device also that you can insert in your vagina that gives you electromagnetic pulses that help strengthen the pelvic floor?
Yeah, we've got two different options for that. So you've got one that you can insert where it will actually electrically stimulate the muscles to contract. I don't usually recommend those a ton for people who can contract it on their own, because it's not the most comfortable feeling in the world to have your pelvic floor electrically stimulated, but it's not functional. If an electric device is doing it for you, you're not learning how to do it. So I don't recommend those all the time. But sometimes I'll have a patient who is early postpartum and they just have no idea. Like they're trying their best and they just can't figure out that muscle. Then we'll use something like that. And eventually they usually figure out what muscle that is. Then you can move on to the other option, which they have biofeedback devices. So an example of that is the PeriFit, where you actually insert this device, and when you contract around that device, it will actually show up in your phone, and you can play games and things like that by strengthening your pelvic floor. And those are kind of cool because it'll have you practice quick contractions, slow contractions, holding it for a period of time. So that can be kind of a fun way to do some very specific pelvic floor stuff. But once again, it's not always super functional because most of the time you're just laying down on your bed playing this game. It's not the same as if you're like at the gym, you're deadlifting, you're
Mm.
squatting. So as pelvic floor therapists, those can be tools that we'll use, but we want to make sure that their treatment looks as similar to what they want to do in life as possible.
Yeah. How can women start listening to their bodies without becoming fearful or overwhelmed?
First thing to recognize is that a lot of pelvic floor conditions can be treated non-surgically. So if you start to notice some of these symptoms, like take a deep breath, there's usually a non-surgical option out there. But just trying to recognize little subtle things like, hey, I don't think I can stop the flow of urine anymore. Or, yeah, you're right. I do leak a little bit if somebody tells a funny joke. Not freaking out about it, like, oh my gosh, something might be horribly wrong, but saying, well, I am getting older and every muscle gets weaker as I get older. Or, well, I did have 3 babies and we know that every birth our pelvic floor takes a hit, but just taking more of that approach of, it's possible that these things are starting to weaken or not be as well trained, but there's a solution for me. Like it does not mean I have to jump into surgery right away. And quite frankly, the sooner you see someone to work on it, the less likely it is to be surgical. When I have patients that come in to see me at age 68 and it's the first time they've ever worried about it, like the chances that it's progressed to a point where we may need surgery is higher than when I have someone coming in postpartum. They think everything's okay, but they're not sure.
Yeah. What would you tell the woman who thinks it's too late to address the pelvic floor issues?
At the end of the day, when patients come in to see me, I tell people I am not anti-surgery. I understand that sometimes it's needed. But when I do an exam with someone, I'm pretty brutally honest if I say, hey, like this is a very severe stage 4 prolapse. We can try a pessary, but the likelihood is that you may need surgery. Um, and you just work with that patient on like how good is their dexterity? How good are they with their home program? Are they open to trying these non-surgical options? But if they're not, we may be looking at surgery. But everything that you learn about how your pelvic floor functions and normalizing bowel movements and all of that, that will help you have a good surgical outcome. So I tell people I don't ever find pelvic floor therapy to be a waste of time unless you were with like a really terrible provider that has no idea what they're doing and is telling you wrong information. No matter what, it's extremely empowering and helpful to learn more about how that part of your body works. So I don't ever find it a waste. And even if you're older and we say, hey, like I've done a thorough exam, I do think surgery is your best option. I'm going to be there to help you prep for that and hopefully have the best outcomes possible. But my oldest patients have been in their 90s, and I used to work in assisted living and independent living. And were our goals 100% dryness? No. Like, but our goals was that that person didn't have to do an extra load of laundry because of leakage. And just making that improvement was a huge, huge improvement in quality of life for those patients.
Yeah. So give us a little recap on that. So if they are having leakage, they need to go and get an exam.
Yeah, because at the end of the day, we don't 100% know where that leakage is coming from unless we do an exam. And I will say there is a difference between seeing like a nurse in a urology clinic who just puts a probe in, or like pelvic floor therapists, we really do a thorough exam. We're looking at how you bend, how you squat, how you brace your abs, like so much stuff outside the pelvic floor. And then we're also looking at the pelvic floor. So you want someone who's going to do a thorough exam, not just somebody who sticks a probe in you and says, squeeze out as hard as you can, and that's it. Because most leakage does not happen when we're laying on our back on a table. So you really want a thorough approach to figuring out why it's happening. But that's your first step. If you have that symptom, your first step is to figure out, well, why do I think it's happening? And once you get the answer to that, then it's okay, now what do I do about it? And everybody's plan is going to be a little bit different depending on what factors are causing it.
Yeah. What's the emotional impact that women have from pelvic floor dysfunction?
I mean, it can be pretty bad. So I specialize in pelvic pain a lot. So my mother has endometriosis. My grandmother had endometriosis. That is an extremely painful pelvic pain condition that is also extremely inflammatory. It impacts your whole body. Like, we're talking about a group of women that usually are kind of gaslit in the medical profession where they're like, oh, you're fine, you just have painful periods. But like,
Yeah.
that's not what that is. It's a very painful condition. So by the time those patients come from me, they are usually struggling to hold a job, they're struggling to have a relationship, they may be struggling with infertility, and they're struggling just to find a doctor that just listens to them. So the emotional, physical impacts of that is really significant. Then when it comes to leakage, you also have people who maybe they're not going to the gym anymore. That's where all their friends are, but they can't go because they're leaking. Maybe they're having leakage when they're having sex with their husband, and it's so embarrassing that they just don't do it anymore. Like, pelvic health conditions play such a vital role in our emotional well-being, our physical well-being, where honestly that's why I like doing what I do, because I find it so much more rewarding than back when I was doing like post-op knees, post-op shoulders, and I'm like, yay, you can bend your knee 20 degrees more. It's just not as rewarding as someone who's like, you get to have pain-free sex for the first time in 10 years, or you get to go back to running with your kiddo and not feeling like you have to sit out on the sidelines and you can't participate with everything they want to do. So it really is a super rewarding job.
Yeah, I can see that. Both of those resonate with me. If someone is listening to this and feels completely seen by this conversation, what guidance can you give them on
Well,
this?
the first things first is Now more than ever, we are a lot easier to find. Like back in the day, there weren't a lot of us. Most of us are on social media. I know I'm on social media. A lot of us are putting out free content on social media where you can follow some of us. And I know for me, if someone has a specific question, I will usually turn it into a reel to answer that. Or I will start posting more content about that so they feel like they're getting a lot of free information. You can also search for us online if you want to find a pelvic floor therapist near you. There are databases that you can search for us, and there's lots of them. But basically, you can search like pelvic rehab provider near me, and you'll see us pop up. I always tell people you want to make sure your pelvic floor therapist is a good fit for you. There's different roads to being certified. So some of us only treat women, some of us only treat men, some of us have taken just one course in pelvic health, and some have taken more.
So men have pelvic floor health.
Yeah.
Tell me about that.
So men also have a pelvic floor as well. Same exact group of muscles. There's a little bit of a difference, but they're pretty much the same. The only difference is men don't give birth. So they don't have that extreme trauma that can happen that makes them more susceptible, but they also can have dysfunction. I've had a huge influx recently of younger men who are having pelvic pain conditions, pain with ejaculation, difficulty urinating. The most common thing we see with men is after prostate surgery. A lot of them have leakage, erectile issues, things like that. So men also have pelvic floors. I will say, I do feel bad for men. Usually I don't because I just feel like everything's better for them. But I will say, in the world of pelvic health, there's not a lot of us that treat men because most of us are female. So some of us don't feel comfortable around male anatomy, or we're treating men, but we don't really want to. Like I see it a lot in like hospital systems is that person doesn't really want to treat men, but they're the only pelvic therapist on caseload and men are calling, so they're seeing them anyways. You want to make sure that you're seeing somebody who enjoys working with you specifically. I get a ton of referrals for men because I'm one of the few people in town that's comfortable diagnosing and treating like erectile dysfunction. It can be uncomfortable for women to work around anatomy they don't have. But I do feel bad because it's rough out there for men to find help with pelvic conditions as well. And it's challenging. Like if you're a male patient, like would you rather see a male provider? Would you rather see a female provider? Both can be uncomfortable for them.
Yeah.
But yes, men have pelvic floors as well. So they also can benefit from this treatment.
Yeah, that would be really difficult for men.
Yeah.
uh, because that's a very vulnerable area for them as well. It relates to a lot of their masculinity.
Yes. And the difficult thing about men, like with women, I have two options to get to the pelvic floor. I can do it vaginally, which most women are comfortable with because we have exams every year, or I can do it rectally as well. Like I've got two options there. For men, I've only got one. And so
Wow, it's only
yes. Only
rectal.
rectal to
Oh,
assess
wow.
that. And for men, that is not something they're used to. Like my older men have usually at least had a prostate exam, but my
Yeah.
younger men, nothing's ever been in there. So they're usually very, very nervous. And it's very intimate. So it can be a little bit of a challenge. Some of us, like myself, were trained in dry needling where we can access the pelvic floor with small needles and we don't have to do an intrarectal exam right away, but that's not fun
What do you
either.
mean by small needles?
So just kind of like acupuncture needles. The
Okay.
only difference is we're directing that needle into a muscle that we suspect is dysfunctional.
Mm.
So there are certain techniques that we can do to, release tight muscles, either inhibit them and, not make them work as well or recruit them so they work better. So there's different techniques we can do with the use of needles if we're trained in it. And some of my men will opt towards that instead of an intrarectal exam.
And do you use like an acupuncture style on women as well?
We can. So I do a lot of dry needling in cesarean scars to try to free up that scar tissue. In pelvic pain conditions, we're doing a lot of dry needling in the abdomen, the glutes, the inner thighs, just trying to get those muscles to calm down. You can also dry needle the pelvic floor in women. Some of those techniques are really, really, really effective. But a lot of times with those patients, you're trying to get an idea of how their nervous system is. Like if they're really amped up, like introducing a needle may not be the best time. But if you can calm that nervous system, it can be really, really effective.
Now, with pelvic floor therapy, you're not only doing internal therapy. I know whenever I had pelvic floor therapy, it was a lot of internal breaking up. I guess, is it fascia? Is that what you're,
It
what it,
depends. It could be
okay.
muscle, it could be fascia. Personally, as someone who's had pelvic floor therapy, um, I try to mix it up a little bit. Like it's not fun to do internal for a very long time and all the
Hmm.
time. So for me, I very rarely spend more than like 10, 15 minutes doing internal work. A lot of times I'm starting with a lot of external work first and trying to figure out, well, if someone has a tight pelvic floor that I'm constantly having to release, why am I having to release it all the time? Do they have an issue with their hip where their hip isn't rotating as well as it should? Are they very stressed out and it's their nervous system that's impacting them? Do they have bowel issues where their stomach hurts all the time, so they're clenching? So a lot of it is you have to figure out why somebody is needing that intervention and trying to fix it so it doesn't feel like you're constantly coming in to get internal work. But most of my appointments are not internal. Very rarely do I do internal every session. Some of my pelvic pain conditions, maybe if they get a lot of benefit, but there's usually other components to that treatment besides just laying on the table and having those muscles worked on.
And is that more physical exercises like leg extensions, hamstring, core work? What does that look like?
It depends on the patient. So
Okay.
sometimes we're doing more mobility, more stretching, things like that. I have a squat rack, so I do a lot of Olympic lifting here where I have a lot of patients who maybe they want to get back to weightlifting and they're leaking, where I will actually grab my barbell and say, okay, we're going to deadlift today. And we're going to see like if there's anything we need to adjust so that you feel stronger and your pelvic floor is activating better. So it depends on the patient. I know for me, I had more attention. So my sessions looked more like nervous system exercises, like stress management strategies. I did a lot of manual work in my jaw and my neck. So sometimes what we need to work on is really far from the pelvic floor, but it's still influencing it. So it just depends on the person. And that's what's crazy about pelvic health is I could have a full day of 10 patients and every single one is pelvic health, but they are all very, very different.
I do a lot of nervous system regulation of breath work and just um, getting my body into a more state of flow. You've mentioned nervous system numerous times. What role does the nervous system play in pelvic health?
It's super important. Honestly, sometimes that's why people are stuck or they're not making progress is because they're in this state where they're constantly in a fight or flight. And if you think about like a dog, what does a dog do when it's scared, when it's anxious? It tucks its tail. And so we do the same thing where we're clenching and tucking our pelvis so you can develop a lot of abnormal tension in that way. If I just sit there and I release the muscles and tell it to calm down, it's going to come right back because your body still feels threatened and it still feels like it's in that fight or flight. It's very similar to when I'm working with fertility patients. Your body does not want to make a baby if it feels like it's running from a bear. So talking to people about their adrenal health, about their nervous system is super important. It may not be important for everybody, but I find like we live in one of the most like overstimulated worlds, and so many people are just stuck in this state where they can't calm down. So I do feel like there's a lot more upregulated nervous systems around, and I am seeing more pelvic tension conditions.
And you think it's because of that?
Yeah, I mean, you can see it in even just like young kids. I mean, I'm seeing a lot more very uptight, tense little kids. There's more constipation than I've ever seen. And in kids, you see a lot of leakage contributing to that. They have chronic constipation. They're really, really upregulated. They're always in front of screens. But we just live in such a very upregulating, stressful world.
Yeah, it's so intense, isn't it?
It
Like,
is.
but I mean, it's all about learning how to regulate our nervous system and coming back into balance. So I love all of this information. What gives you the most hope when it comes to the future of women's health and the pelvic floor in general?
I will say that ever since the creation of Instagram, I will credit Instagram. There has been a lot more discussion, education, a lot more happening in the world of pelvic health. It is leaps and bounds from where it was when I was in school. So nowadays we have way more providers than we've ever had. We have students who are getting involved in pelvic health while they're still in school, so that we've got a whole bunch of new pelvic health providers. We've got more resources out there than ever for patients to turn to. And now there's new things coming out for us as providers, like new conferences, new courses where we can just get even better. Um, and there's also things happening in the field of women's health, like women are finally being included in research. It's great to see. You
Yeah.
know, we finally don't have a black box label on vaginal estrogen. Like, that's great to see. We don't have as much fear around hormones as we did before. So there's a lot that's happening in the space of women's health that makes me excited. You know, we're finally researching postpartum women a lot more. We're still not at the level of other countries like France, where you get an automatic referral to pelvic floor therapy as soon as you give birth. We're not there yet, but I am seeing more people coming in and finding us on their own and coming in without a script and just seeing us because they think it's important. I'm seeing more patients coming in before major surgeries. So I do think things are getting better.
Does insurance pay for physical therapy of the pelvic floor?
Yeah, so insurance will pay for it. What you'll see a lot of, and this is how my practice is structured, is a lot of pelvic floor therapists, we don't contract with insurance, not because we're trying to take your money, but because when we contract with insurance, we have to have like a referral to see you. They dictate how often we can see you. They won't let us continue to treat you after a certain amount of time. They only pay us like $40 and then our clinic can't stay open. So I get in this discussion with people all the time because the first question they ask, and some people will say in an email, the most important question, do you take my insurance? And I will respond and say, actually, the most important question is, can I help you? The second question can then be, do I take your insurance? But the most important question should be, can I help you? Am I qualified? Have I treated this before? So what I do in my clinic is I don't contract with insurance, so you can come whenever you want. You don't need a referral. If you want to pop in once every 3 months, that's fine with me. And that I get to treat you for a whole hour, and it does not matter if I want to be hands-on the whole time. Doesn't matter. No one's telling me I can't do that. But then I give you basically a piece of paper so you can submit for reimbursement. It depends on
Mm,
your insurance plan whether they will pay you back for that. But that's where you're seeing it evolve a lot because pelvic health providers cannot double book patients. We can only see one patient at a time because we
mhm.
can't do two vaginal exams at once. And so that can be a big stress on a clinic because in physical therapy, due to low reimbursement from insurance, we usually have to see multiple patients at once just to keep the doors open. You know, we don't make a lot from your insurance. So that is an interesting dynamic. And I know I pay out of pocket for almost all my healthcare because it's just better care.
Yeah, I agree. I pay out of pocket. People should know that anything that you pay out of pocket for healthcare, you can put to your taxes.
Yes.
That
Yeah.
any healthcare you spend, you can put that on your taxes as a tax deduction.
Yeah, and
So
if you have an HSA account, that's another tax deduction. You can put money into that account. It's only to be used for health expenses, but that's another tax deduction. And a lot of people don't realize that, but I have an HSA card and I use it for all my health care. And I also I budget how much money to put into like a little fund for my health care. And then I have a spreadsheet for every dollar I've spent on health care. And I put that in my taxes every year.
yeah, I love that. Bri, thank you so much for bringing light to this extremely important topic. Is there anything else that listeners need to know about pelvic floor or the future of pelvic floor?
I mean, the biggest thing I would say is don't be afraid to ask for help. And at the end of the day, if you don't click with your provider, if you don't feel like they're doing some of the things we talk about, there's more options now. So I don't want you to stay with someone that you're just not meshing with and you're not clicking with, because it's a very intimate thing that we do. And we want you to feel comfortable. When patients come in, I mean, the biggest thing about my practice is I do all the scheduling, I do everything. So when you're emailing someone, when you're on the phone, it's always me. So you can get a good idea before you even come in for the appointment if it sounds like we're going to jive. So I always tell people, if you're uncomfortable, like that may be detrimental to your treatment. Like if you feel an icky vibe with your provider, like just find a new one, because we want your nervous system relaxed. We want you to feel comfortable and we want you to have a good experience. And there's more of us out there now. Some of us do virtual and in person. There's lots of options out there. But definitely start with the non-invasive stuff first, because surgical rates sometimes aren't as great, but they're even better if you start with, learning as much as possible.
Yeah, 1000%. Thank you so much
Yeah.
for joining me on this such important topic that women need to know, especially if you've had a baby or you're having a baby or you're getting older and everything is starting to weaken. I mean, I think we all should be informed about pelvic health. I think that is topic that we give little attention to. And so thank you so much for coming on here and joining us. You guys, if this episode resonated with you, please hit the like button. Please subscribe. Give us a comment. I'm going to put all of Dr. Bri's information in the show notes. So if you want to reach out to her, you can follow her on Instagram, get some free information, and we are immensely grateful for you being here. Thank you so much.
Yeah, thank you for having me. It was fun.